educator for Sterile Processing University.
And I'm Nancy Chobin, the president of Sterile Processing University.
All right, Nancy, here we are again, another episode, and this time we're going to hit the dental subject.
Yeah, this is one that is really long overdue. The dental industry has kind of flew under the radar for a long time. And, there's really important information we have to get out there to them.
Yeah, different rules, I guess, as of right now, right? No regulatory.
There aren't. The interesting thing is, if you read the national standard, AAMI ST 79, it clearly states on the very first page that this document is applicable to all facilities performing cleaning, disinfection, or sterilization. And then they list them: hospitals, surgery centers, doctor's office, dental offices, clinics. It's all there. But because they don't get inspected unless there's an OSHA violation that someone has complained about, is nobody to really tell them if they're doing things wrong.
Wow. Yeah. I mean, that's true. That's just, I never realized that the dental was actually listed.
Yeah. There's recommendations from the American Dental Association, but they don't come close to what AAMI has. And that's why 3 years ago, when I was giving my management course, I had a young lady who worked in a dental clinic. And at the end of the course, on the evaluation form, she wrote, "I am so glad that I took this course because we are doing none of this." And that was an eye-opener for me. And that's when I decided that was like the last frontier. You and I have worked in hospitals and surgery centers and clinics. This was one we had never tapped. And the time had come that we bring them up to the same standards. So that's when we developed the Basics of Sterilization for Dental Facilities, a textbook and an online course. But it's had very little activity. People just aren't aware of it. So we're trying to get the message out there to them.
Yeah, because I would imagine, you come across a lot of sterile processing people that work in hospitals, and some of them, more know about AAMI now, but you still get people that don't know what AAMI is or what it stands for. And, sometimes it's the newer people. And I can only imagine on it, you say the word AAMI to dental office people, they'll have no clue what you're talking about.
No. Well, today I was at my podiatrist, and he asked me, what I was going to do today, just a general conversation. And I told him I was doing a podcast on dental. And he said, "What's that going to be about?" And I told him, and his eyeballs almost came out of his head. I said to him, I have seen it all. I said, I worked with many dental facilities. I said, Jason did one a number of years ago that he helped. And I said, they still keep in touch with us. They're so happy that we helped them. I said, about 10 years ago, I was contracted by the U.S. Navy, and I developed a DVD program, 8 DVDs on cleaning, disinfection, sterilization based on AAMI standards. If there was something in CDC that went above and beyond, I included it. But they put that on their mainframe, and all of the Navy dentists, regardless of where they were in the world, they were able to participate in that program. And we had that one dentist who called me and said, "Are you the lady that developed this program?" And I said, "Yes." He said, "Well, I want you to know I completed the program now that I'm out of the Navy, and I haven't slept one night because we're not doing any of this."
Yeah. I actually remember, because I was the one that went to the facility, and, great open mind, though. It was a pleasure to be there. And they really did. I have to say, we've been to so many places. I think we had more compliance in that dental office than we did in hospitals.
Yes. Well, that's part of the issue. I mean, I've been to doctors' offices, and they outright tell me, "I don't have to do that." I said, "Well, yes, you do." "No, you don't. It's not a law." It doesn't have to be a law, because when you are in a court of law, and dentists have been sued. We had a major incident here in New Jersey about 10 years ago. where a dentist actually wound up giving myocarditis to several patients. I don't remember if one of them died or not, but the health department was called in and they traced it to multiple infection control violations, including improper sterilization.
Wow.
So, these national standards are recognized in a court of law. And if you're not complying with them, you're going to pay the price.
Mm-hmm. And so I guess we need to break this down here because, a lot of dentists do their work. So, when it comes to dental sterilization, it entails so many different steps that they might not realize because not a lot of them do that. But of course, obviously, the first step in anything is the decontam process.
Right, right. Well, I've learned over the years that dentists, doctors, surgeons, and even nursing get very little about sterilization in their education.
Mm-hmm.
They know it has to be sterile. They know how to open it. They know, what parts of the body are more subject to sterility than other parts. But if you had to ask them what a biological was or what a Bowie Dick test was, they look at you like, what do you have, two heads? So
Mm-hmm.
it is the responsibility of the people who are doing it. But nobody's telling them what to do.
Mm-hmm.
They come in and, I've had people say to me, oh, we wash them a little bit with some Dawn and then we cook them. No, you cook in a microwave. You sterilize instruments in a sterilizer. It really upsets me when people talk about cooking instruments because it gives you the impression that they don't realize the seriousness of this.
Yeah.
And I'm so sick of hearing, well, the mouth is not sterile. No, but once you go into my gums, that is sterile. And we all know or should know that if you get infection in the mouth, at two places it can go, brain and heart. I don't want either one.
Yeah. And that's, a lot of people don't know that.
Yeah.
And that whole theory of, oh, it's your mouth. That just, I know in the operating room, when we had laryngoscopes and stuff, we didn't, sit there and go, oh, it's just the mouth. Let's not sterilize it. We still sent it to sterile processing, had stuff packaged and wrapped and, sterilized correctly, put in containers. The mouth doesn't mean let's do anything you want.
Well, when you look at Spalding classification, it was revised to some degree a couple of years ago when Amy came out with ST91, the endoscope document. And they said for semi-critical items that come in contact with intact mucous membranes, such as a laryngoscope blade, it should be sterilized. However, if sterilization is not possible, for example, maybe you have fiber optic ones that can't go through steam. Maybe it has to go through like STERRAD, but you don't have STERRAD. So then high-level disinfection is the minimum you could do.
Mm-hmm. Yes.
But, people just, again, unless someone knows that, unless they learn that, this is God's honest truth. Alcohol wipe, clean off the alcohol blade, put it back in the code cart.
Ooh. Yeah.
Just clean it off with an alcohol blade. Yeah. With an alcohol wipe. Now, when you think about that, the Joint Commission a number of years ago said that anything that's high-level disinfected, of course, alcohol is not high-level disinfection, but if you high-level disinfect an item, you have to protect it from recontamination. So you can't just put it right in your emergency kit or whatever you call it.
Mm-hmm.
Because first of all, when you open the drawer, how do you know was it used and just put back in there? How do you know somebody didn't touch it with the hand and say, oh, no, I don't want this one. I want this one. So all of these things we've learned, unfortunately, through, getting cited or hearing from other people that was cited. And that's why we have all of these standards to follow. And people say, oh, there's too many. You got one for this, one for that. Yeah, that's right. And it's for your protection and your patient's protection.
It's just more is going to come, not less.
Absolutely. Absolutely.
So,
well, just one thing. the American Dental Association did contact Amy and said they wanted to align their guidelines. They have guidelines, not national standards, but they wanted to align with Amy. And for the past year or so, they have been doing that. So there will be a new dental standard coming out from Amy. And then you're really going to see things rock and roll.
Yeah, that's I think that's the key point of where, you know, I wonder if once they get that kind of standard out there, will they start having inspections?
Well, they should. They should start having education. You know, they talk about, you know, well, we're complying with ADA, American Dental Association, but it has been a challenge with that group. I remember when we were first starting to do what used to be ST46 was the original STEAM document. Before, Amy used to have a different document for decontam, flash, and what have you. And people didn't buy them because it was too much to buy 5 different documents. So over an 8-year period, we took the task of combining all of those documents. And that's why it's called the Comprehensive Guide, because it includes decontam, prep and packaging, high disinfection, sterilization, sterile storage. It's all in one document. Now, if you're doing high-level disinfection of scopes, that's a separate document because there's much more that's entails. But that document is going to be available, and I hope they buy it, and I hope they comply with it.
Mm-hmm. So for dental sterilization, I mean, I would, you know, most dental offices use the sterilizers, small ones or tabletops, right?
Yes.
I would imagine I haven't really come across much of high level disinfection in dental offices. I don't know if you have.
No, I haven't come across, unless they're in a clinic that's also doing dental as well as something else. I have one large multi-practice dental facility that does GYN exams, and some of their items do have to be high level disinfected. But no, for just a straight dental office, I'm not aware of anything. But that doesn't mean you have to follow the manufacturer's instructions. And that's another thing. You know, well, we don't have it, so we just put everything in the sterilizer. You don't make that decision. It's the device manufacturer. How many of them even have it? How many of them can even find it? How many have ever looked at it?
And I mean, let's face it, you know, that, you know, eyes and dental are, you know, you get some nice European companies and you start getting some crazy IFUs that are hard to you know, to follow.
Well, you have 2 issues here. One, you have the sterilizer issue. Again, you know, in a large hospital, you may have a clinic. One of our hospitals had a very large dental clinic. They would see like 1,000 patients a day. And they had large sterilizers in their dental clinic. Well, you had to when you had that volume. But the majority, when you talk about dental offices, they have tabletops. Are they aware that the tabletop must have a printer? Otherwise, they're not supposed to use it. No. They use it anyway. Are they aware that there's only certain cycles that you could use on that sterilizer? And are they reconciling the temperature and exposure time that they're using on their sterilizer with the temperature and exposure time for what they're trying to sterilize? So as you mentioned, you know, there's many instruments that are made in Europe, and they're very, very fine instruments. But in Europe, they validate their instruments at a different temperature, 273. So when they come to the United States, you can't put them in a sterilizer that operates at 270.
No.
But they do.
Yes. Well, you know, that's the sad part. You know, tabletops have got such a bad rap. And it's not really much to do with the tabletops in the sense that no matter how experienced you are in sterilization and how many different certifications you got, the average person does not know how to work the tabletops because they know only the bigger sterilization equipment and they think they can just transfer that knowledge over to the smaller, but it's a completely different animal.
Completely different. You have You have, of course, gravity sterilizers,
Mhm.
which operate like the gravity sterilizers we have, but there aren't too many things that need gravity today. You have your um, pre-vacuum sterilizers and your steam flush pressure pulse. Now, those two are under the heading of dynamic air removal. With one of them, it removes the air before they get sterilized. That's why it's called pre-vacuum. It draws the vacuum before the steam is injected. Whereas the steam flush pressure pulse, it draws a little vacuum and injects the steam throughout the conditioning phase. And that seems to be very efficient at air removal because it's done above atmospheric pressure. So on a steam flush pressure pulse, you don't even have to do a Bowie-Dick test because it's so efficient to remove the air. But you always have to check the sterilizer user manual to be sure.
Mhm.
But I have yet to find anybody when I go in and say, what type of a sterilizer you have? They'll give me the name brand. And I say, no, is it steam flush pressure pulse, gravity? Oh, it's gravity. And I go and look, and it's steam flush pressure pulse. And they said, well, I called the company and that's what we told me. Well, that's not an excuse. You know, when you get into a court of law, if you get in trouble and they tell you that, they go, you're responsible. You brought that equipment in. You should know what you're purchasing. And
Yeah.
most of them don't.
Yeah, I mean, it's one of these things. If you're using a tabletop and you really haven't had that experience, the first thing you should be doing is pulling out your user manual
Yeah.
and reading it. Because like as you'll find, there's not only there's maintenance,
Oh,
there's
yeah.
loading, there's testing. I mean, all this stuff can be so different, especially
Well,
loading.
when it comes to, let's start with, cleaning is, of course, the first step in sterilization and should be no different for dental instruments as well. I go in, they do not have a sonic.
Hmm.
Or if they have a sonic, that's all they have. Now, that may be okay. You have to look at the IFU. And they have to
Uh-huh.
understand if they only have a sonic, they still should do manual cleaning first because you never put dirty or soiled instruments in a sonic cleaner because it will interfere with the cavitation. And after you put them in the sonic cleaner, you rinse them with treated water because that's the final step. And then you have to wear gloves when you handle them because they haven't been decontaminated. They haven't been subjected to that heat cycle like you have a washer disinfector.
Uh-huh.
Uh, so none of that is known. But when you get into sterilization, they have to know how to load it. And we have some pictures to show the right way and the wrong way.
You want
Um,
I can
and
put that up.
again, Jason, you brought this up before. I do not stage these pictures. These are things that I've actually found. If you look at the one on the left, and this is a biggie, peel packs. In larger sterilizers and in AMI ST79, peel packs should be placed on their edge, standing up on their side, in a peel pack separator to allow for expansion and contraction. Go back to that one again.
Yep, that's what you were just saying.
Yeah.
That one.
And in some of them, they tell you to put them face up, face down, or any place you could put them. That's wrong. And it's in the user manual. So
Yes.
I've contacted the companies. Now, one company has already changed their manual and offers a peel pack separator. You look at the one on the right, you need to have 1 inch of space between all of the items and no stacking. What part of that didn't they understand?
Yeah. I mean, look at the bottom. Like
Yeah.
they're sticking them on the bottom of it. That's
Well, wherever there's space, we want to fill it up as much as we can so we can go home at the end of the day, run one cycle.
well, now the
So
picture to the left. What is that? I'm having a
they're
hard
peel
time.
packs turned upside down with the paper side up in a lasagna pan. Well, it's actually, it's a stainless steel. I call them lasagna pans because they're about 3 inches tall. But that's the way they were sterilized because they said, no, we have to sterilize them with the plastic side down. No. Well, what about the plastic side up? No. Well, we don't have any way to keep them on their side. Then you get one.
Yeah.
You get a peel pack separator. Nobody in a court of law is going to accept you didn't have one, or
Yeah.
they wouldn't allow me to buy one. It's going to cost you a lot more money when you win that lawsuit, or when you
Absolutely.
lose the lawsuit. I just had someone contact me from a facility that has a large dental practice associated with a hospital. And she is doing a biological test once a week. She wants to go to every day because she recognizes the issues that if she has a negative biological on Monday and then next Monday she gets a positive, where did it go wrong? She now has to recall every single item that was processed over that week, trace it to the patient, and then notify the authorities. Well, first of all, their record keeping is terrible. They put 5 pliers, 3 peel packs. They do not trace anything to the patient. They do not identify what's in the load. So they're not even able to do a good job of tracking to the patient. So in that case, I sent some information and said they need to understand the ramifications of not doing a BI once a day. Now, if you don't use the sterilizer on a certain day, well, there's no need to run a BI. But
Yeah.
if you're running your sterilizer every day, then you should be running one every day.
Uh-huh.
But these are the things that are happening out there.
Yeah, and and I think it's definitely lack of education, and especially, I mean, I would imagine a dental assistance program. I mean, it's only usually a few, some weeks,
Right.
maybe a couple of months. I mean, like as we were saying in another podcast, some people take over a year to get comfortable in sterilization.
Right. Well, there's issues with English as a second language in
Uh-huh.
many of these facilities, and that happens in hospitals too. But hospitals have more resources.
Yeah.
But that's still not an excuse for getting people to be able to read instructions for use, to be able to read policies. But guess what? They don't even have policies. When I
Yeah.
go in, where's your sterilization policies? They look at me like I have 2 heads.
Yeah.
And if you don't have a policy, you can't hold your staff accountable, nor can you defend yourself in a court of law if something goes wrong.
Correct. Now, let me ask you opinion on this here. Like I was just saying, like a lot of times it's the dental assistants that do the sterilization. They're taught a little bit. You also have some places will have their hygienists do it.
Right.
Um, you know, very rarely would you see anybody else do that. Do you think a dentist office should look towards having a sterilization person, or just somebody who has a background in it, or kind of rely on the dental assistants and the hygienists?
I think they should take the approach that Amy did. Anyone performing cleaning, disinfection, or sterilization should be certified. I don't know if the American Dental Association is going to accept that. I don't know where it is in the document, if it's even been discussed. They might have put that on the back burner. But to
Uh-huh.
me, what difference does it make? If you're going into sterile tissue, it has to be sterile. And if
Yeah.
you're performing sterilization, I don't care what discipline you're working in, it has to be done by the same standards.
Yes. Yeah, I
When
think.
we start lowering standards is when we get into trouble, no matter what, whether in the hospital or any place else. I'm sure in your experience in the OR, you've heard what I've heard. Well, the doctor always does that. He likes to stand back with his hands in his armpits. That's the way he's comfortable. I
Yes.
don't think so.
Yes. I heard.
So if something happens, you're allowing that behavior to continue.
Mhm.
And something happens, then you're going to have to be accountable for that.
Yeah. I think it too, and it's about assigning it to the appropriate people, because I know we've had this conversation where is it the hygienist doing it, or is the dental assistants doing the sterilization? And I just like the hygienists work independently. Most of them have their own schedule. They
Yeah.
don't, you know, so I hate to see that thrown on them because they're worrying about taking care of the patient right then and there that day. They're actually doing all the work on the patient. So I would like to see hopefully the dentist industry, lean it towards more of the dental assistants and giving them the education and tools they need for that so that they can concentrate on that. It's hard to be the caretaker of the patient and then have to do, the cleaning, the wrapping, the sterilization, because you gotta that deserves the same equal time as you do when you give a patient.
Well, I can tell you, at the practice that I was going to after I was there for 20 years, and then the dentist developed Parkinson's and had to sell the practice. And the practice was turned over like 4 times in 7 years. But they had the same dental hygienist. And on one occasion, she brought the peel packs over, and she had instrument marking tape on them that was so dehydrated it was disgusting. And I pointed it out to her, and she looked at me like I smacked her in the face. And I said, I'm sorry, you're not going to use that on me. Another time, she brought me an instrument that had blood staining in the package. And I told her this was not cleaned properly. You're not going to use it on me. The last one, which is about a year ago before they closed, she brought me a package that had a hole in it. It was a scaler. And, that really should have tip protectors on it.
Yeah.
And I said, you're not going to use that on me. It's not sterile. I said, there's a hole in the package. Oh, I missed it, which she probably did. But the fact remains, you're right. Their expertise is cleaning the teeth. And if they're doing this, they're doing it as an afterthought. And I don't mean that in a derogatory way, but it's not their primary job.
Yeah. Because I really want the person that's doing the work on me to be paying attention to me, not worrying about, oh, I got a pile of instruments behind me that got to get, cleaned and sterilized. And that's just not fair to the patient, not fair to the worker.
And I don't know how that works. I don't know if they get paid by the facility so much money based on how many patients they do. I don't know about that. All I know is that, if I'm supposed to be finished at 5 o'clock and now I've got, 30, 40 instruments that I have to clean, I'm staying here on my time. I'm not getting paid for it. Is there, and I'm not saying it's deliberate, but sometimes I could see where people would rush through it because they want to get out of there and get home to their families or what have you. That's not right or wrong. Shouldn't be done. It also could be very frustrating to them because maybe they're working in a practice that would be open to making changes, whereas at another facility, they're going to say no. And if they object, they could maybe lose their business there. So it opens up a whole can of worms. But the bottom line is it's got to be done right, period.
Yeah. Yeah, you sign it to the person. They need to know what they're doing, and they need to have the time to do it right.
Exactly. I mean, I remember when we really started hitting facilities hard with Amy documents was probably in the mid 80s when I became involved with Amy, and I realized how important these standards were and how much wrong we were doing. And then when we worked on the combination of the 5 documents, that's when it really hit, because when that was published, everybody was told, this is your Bible now. This is what you follow. And there was a lot of resistance because people were doing so much wrong. And now they had to make all the corrections at one time. So, people need to understand that when you have major changes, like with the water quality document, if it's going to involve major capital investment, you can certainly say, we're going to do A, B, and C now, but we have to postpone this until next year because of the cost, as long as it's not a patient safety issue. If it's a patient safety issue and you postpone it and something happens, that's not going to be an excuse in a court of law.
Yeah.
You see, everything we do, and I've said this before, has to be defensible. We never know when we're going to get sued, and hopefully it'll never happen. But don't say it never will happen, because it has happened. And you could go on Google and find hundreds of cases that have applied, even in the dental industry.
Yeah, it's amazing how, and it's always amazed me how much gets pushed under the rug. But then even for the amount of stuff that doesn't get pushed under the rug and gets out in the public, nobody takes it serious. This, like you were mentioning before, where you were challenging, well, not challenging, but, expressing that, you're not going to use something on me because you identified that it was packaged wrong, or that had blood on it, or had a hole in it. Did you ever have to seriously, did you ever get like somebody fighting you back and going to the point where you had to say, I'm leaving. I'm not having that procedure.
No, because I told them exactly what was wrong.
Yeah.
But most patients don't know that. I don't know if you remember, it was a number of years ago, I think, when they had the outbreak of infection out on the West Coast due to colonoscopes. And the FDA actually said, you need to ask questions when you go to a doctor. But my opinion, it's any treatment. How do you prepare the instruments or devices that you're using on me? When I went for my first colonoscopy, I said to the gastroenterologist, after he told me his procedure and everything, I said, I have a few questions for you. And he said, sure. I said, how do you clean and disinfect the endoscopes? And he looked at me like I smacked him in the face. And he said, why do you want to know? I said, because you're going to use it on me. And he said, okay. He took me in the back and he showed me. And then he started asking me questions. Did I make the right decision? Am I using the right chemical? I mean, he was very open to it. And, he retired last year, but the practice still maintains the same. As a matter of fact, when I go in there, they go, uh-oh, Joy Commission's here. But I know they know me now. I've had so many of them over the years. But, you have to be proactive. My daughter needs to have my granddaughter's wisdom teeth removed. And she had to find a special oral surgeon, because my granddaughter is on the autism spectrum. And she was interviewing a dentist who had a very high rating, an oral surgeon, sorry. And she said, I'd like to know how you sterilize your instruments. You know what the response was? I don't know. That's not my job. Whatever they do, they do. And my daughter said, thank you very much. I will not be coming to you.
Good.
I mean, she had no interest. That's their job. Bottom line is, it's their job, but they report to you. You got to know what's going on in your own department, in your own building.
Yeah. Yeah, that's
you got to ask questions.
Because the infection control principles are pretty much the same. And I would imagine a dentist's office would have a designated infection control.
It's not required.
No,
it's not required. Now, the Association for Dental Safety, they're all infection control people, multi-specialty. They don't just do dentistry. A colleague of mine who's an excellent infection preventionist, she was the one who told me about the organization and said, you should join them, because she was a member. So they do have other clients. And unfortunately, sometimes they get involved because there was, a situation where they got in trouble. Most often, though, believe it or not, they just go in to do OSHA training, the annual OSHA bloodborne pathogen training they have to have. And that's all they're allowed to do. When my son had oral surgery, I asked the oral surgeon, and unfortunately, I didn't do it the day of the surgery because I had another appointment. I dropped my son off, and then after the appointment, I was going back to get him. And I said to him, I said, can I see your sterilization methods? And he said, no. And I said, what are you trying to hide? He said, I follow all of the standards. And he walked out of the room. Yep. Needless to say, I'd never go back to him. If you're hiding something, if you're not going to allow me to ask questions, then I don't have any respect for you. I'm sorry. You should be proud of what you're doing. And just a statement that we follow all of the AMI or even American Dental Association standards. I would be happy with that. But to blow somebody off,
Mhm.
no, no, you've got to be proactive regardless of where you're getting care today.
Oh yeah, you really. I mean, you got to speak up. I mean, and not even just dental offices. People got to realize that stuff is not necessarily followed out through on all kind of levels. Surgical centers, hospitals. Uh, when it comes
Yeah,
to sterilization. Now, because also I would imagine dental. I mean, and I know this. I mean, you know this. I know this. The smaller places, especially when they're doing minor procedures, have a high volume, but usually do not have the instrumentation to support that high volume to turn it
yeah,
over correctly, to sterilize it correctly. You need to know what your cleaning process, the correct cleaning process, how long your sterilization process is, so you can, estimate when you put when you have an instrument and your doctor needs it back, is it 2 hours, 3 hours, 4 hours?
well, when you think about again the difference between a hospital or surgery center and a dental office, I still see, unfortunately, where you go into a facility and say, "How often do you change the water in your sonic cleaner?"
Hmm.
And they go, "When it looks dirty." Well, that's too late.
Yeah.
Some of them, yeah, I had actually had people say we change it once a week, we change it once a day. And the Amy standard is you have to determine the frequency, because by the time it turns dirty, you've already have put millions of microorganisms
Oh
back
yeah.
on that instrument.
Uh-huh.
And we didn't learn that until a number of years ago. So maybe when you're doing dental instruments, if you're hand cleaning them and you're doing a good job of cleaning, and then you put them in the sonic cleaner, maybe you can get away with 3 uses of the water, and then you drain it, you put new water in, and what have you. You speak to them about degassing the sonic. Never heard of it.
Uh-huh. I tell you, I know there's the rules, and I know that with the sonic, with changing the water, but I can't. I have to change it every time.
Well, I mean, you have that option. That
Yeah.
would, I mean, that would certainly be the option that you have to do that.
Yeah.
Um, the advantage with the sonic cleaner is that because it sucks the debris out from your box locks and joints that you can't get with manual cleaning, nor can you get with automated cleaning. So
Uh-huh.
that's why it's a 3-step process. You
Yes.
do the manual cleaning, you do the sonic cleaning, and then you put it in the washer. But even how they load the washer counts. If the instruments are all closed, when you put them in the sonic or even in for manual cleaning, they're not going to come out clean. I use the example, if I stand in the shower and let the water run over me, am I going to get clean? I don't know, but I can tell you, Jason, I took a shower today.
Yes.
Okay. Now, if I take a shower with a washcloth and I have my wash gel and I get in all the nooks and crannies, I
Mhm.
took a shower. I did it right. But just because somebody said I cleaned it doesn't mean they cleaned it correctly. How did they clean it?
Yeah.
And did they follow the IFU? Some of these IFUs go on for pages.
It's either it's overkill, or sometimes there's just not enough.
Well, if you question an IFU, and I
Uh-huh.
have questioned many of them, and I've reported many manufacturers to the FDA because of that, um, you have to use your judgment. If
Yeah.
they're telling you to do something, like put it in a sonic for 1 minute, and then telling you to do something else that you know is incorrect, you have to call them and say to them, I have a problem with this. This is not accepted practice. Why are you telling me to do this? Because my sonic manufacturer is telling me that I need 10 minutes of sonication. You're telling me I only need 1 minute. Am I going to get it clean? What machine did you test it on that said that we only needed a minute? Maybe that's not the machine I have. But again, people think, and this is a very fine line, that what's in that IFU is Bible.
Yes.
Yes, it's Bible as long as it makes sense.
Uh-huh.
But if you have any doubt, you have to call the company. Now, if you call customer service, they're just going to read what's in the IFU. They're not technical people.
Yeah.
You have to ask for either a technical rep or the product manager who actually did the testing on it. And then get a discussion, and whatever the outcome is, make sure you get it in writing from the company, what they told you to do. And then if they do say, no, this is all you can do, then you attach it to the IFU. So you always have it for reference in the event of litigation or if you have an inspection. But again, nobody's doing it because they don't even have IFUs.
Yeah. I mean, and again, just like you said, sales reps, they're nice people, and they're there to do a job, but their job is not. A lot of times, some are there to do education, but a lot of them there are just to sell. And they're the worst one to go to when you say, can I get an IFU? And they're just like, oh yeah, I have one on my phone, or I have this, and they'll go, I can give it to you, but there's not much. I don't know anything about it. You got, like you said, you really got to call the company and ask for the correct person, because the salesperson 99% of the time is just there to make the sale, and they will tell you what they are told to tell you to make the sale.
Yeah. Well, most of them can tell you about the sterilizer, but they're not going to be able to tell you what tests to run, how to run them, what happens when something goes wrong. That's not their area of expertise. I mean, I had a sales rep, and I think I've said this story once on another podcast here, that came in with a laparoscopic liver retractor. And she gave an in-service and said, you enzyme pre-soak it, you put it in the sonic, and then you rinse it and you dry it and you wrap it. And I said, no, I'm sorry. She said you didn't have to sonic it. You then put it in the washer, and then you wrapped it and you sterilize it, blah, blah, blah. And but she didn't bring the IFU, so I told her to send it in to me, which she did. And when I read it, you had to sonicate it for 10 minutes. So I called her up and I said, you're coming back tomorrow, and you're going to re-in-service the staff according to the IFU. I said, because you've led them to believe they didn't have to do it, and that's not complying with your own company's instructions. Oh, I'm sorry, I didn't know that. I said, well, you should. If you're giving education, you should know, not only, they know what to do in the operating room. They'll tell them how to use it up there. But when it comes to cleaning.
Because they get a lot of training for the surgical parts of it. They get zero training for, I mean, the other thing that I've also seen with sales reps is they go around to so many places, and they make great relationships with people. And then they go, they might know this one place and know a lot about it. And they go, well, just do what that facility does. That's what they do when I drop it off. And I hear that a lot. And it's like, I'm not doing what some random facility's doing. That's not my policy,
I just had that with a center here that did a lot of orthopedic surgery. And I would not allow them to do 273 on their sterilizers, because their sterilizers were pre-back at 270. And he was arguing with me because, he had all the surgeons really online. They were going to start, there was a new service line. They were going to be using only his instruments and implants. And I guess he could see the dollar signs. And I said, no. I said, you are not going to sterilize your instruments at this facility at that temperature. You have to go back to your company and tell them that. I said, I'm going to alert the surgeons that this is a liability for them. Well, the surgeons were listening to the rep, and, they were kind of, but infection control backed me up. The director of nursing backed me up, although she didn't really have a strong background, but she gave us her full support. He scheduled 2 conference calls, one with the product manager and then one with the president of the company.
Wow.
And I spoke to him and I told him what the issue was, and he was shocked. He said, we have been in hundreds of hospitals all over the country and at least 25 in New Jersey, and no one has ever brought this to our attention. I said, well, welcome to my world. Do you know that they went back and within 24 hours, apparently, I don't know how they did this, but they went back and validated and gave me an IFU that said 274 minutes pre-back.
Hey.
So you got to put your foot down.
Absolutely. And also, we were talking about, what staff is responsible, and obviously it's thrown in a lot of different people's hands. So competencies.
Yeah, competencies play a big role. And another thing that falls under that category, Jason, is who's making the decision about the products they're buying. You don't have a materials person in dental offices. It's usually left up to whoever's doing the sterilization.
Uh-huh.
Some of these are people up the street that have no medical or surgical background at all.
Uh-huh.
And so I go in and I find that they're using BIs that were never validated for tabletop sterilizers.
Uh-huh.
They went out and bought, the 24-minute BI. And, if it doesn't say tabletop in there, you cannot use it in a tabletop.
Uh-huh.
And so they don't have the expertise. And then no one does competencies. I mean, they don't even have policies. So
Yeah.
how can you challenge them? You
Yeah.
have to have policies for them to refer to so that they can do it right. So competencies are critical, but you don't, this so far, that's like the third thing on the totem pole. You got to start. When we go in, what's the first thing we do? We look at the policies. If they don't have them, we know we're already in trouble.
Yes.
The second thing we do is we do an audit. We look at everything. We look at their sterilization records. We look at their decontam records. We look at their packaging. We go into the sterile storage. Most of their items are peel packed, but for the larger sets, you might have them in a cassette. So we look at how they package them. We look at their dating system. Most of them don't have one. If they do, they give it like 5 years.
Yep.
So that tells us we have to start from scratch. So then we go into the action plan where we start with policies and procedures. That gives us an opportunity to educate them what they need to do.
Yes.
And after we do all of that training with the policies and procedures, then and only then can we start doing competency assessments. So anybody that tells me that they go in and do competency assessments and they pass them, I have very little credibility in the validity of them unless they have the policies and they're doing everything according to the standards.
So I guess in a dental facility, there's really no educator, there's really no sterile processing managers or supervisors. No. So who do you think would be best to monitor the competencies?
Well, I would say sterile processing people who are certified, but also know tabletop sterilizers. That's their weakness.
Uh-huh.
You have to know about everything about tabletop sterilizers, but they know the products, they know how they're used, they know the different sterilization methods. You have to have somebody doing competencies who knows what they're doing. How can you assess someone if you yourself have never done it before?
Yep, and I know
to make a determination they're doing it right or wrong.
Because I know a lot of infection control people are going to be hired to do those competencies, and it's the same thing you're saying.
They can't do it,
yeah,
because that it's not recognized by Joint Commission or anybody else. They do not have the expertise. Just like if I went in to do competencies on an infection control nurse.
Yeah.
I know infection control as it applies to sterilization, but I would never put myself in that position.
Yeah.
So they have their area and we have our area. We have to work together. If there's an infection control problem, we have to notify them so we could work collaboratively, but they should not be doing competencies for sterilization. No.
Yeah. And that does happen a lot. A lot of them don't want to do that, and then they do go look for, a sterile processing consultant to do it, which is, you could pretty much find, but you got to make sure you're hiring somebody that really is a consultant versus somebody who's just moonlighting trying to make extra money.
Right, and they have some consulting with dental facilities under their belt because it is a total different animal. I had an employee that was working for me at one point, and she was excellent at sterile processing, but she went into a surgery center and put in her report, which she sent before I reviewed and approved it, that they had to move a flash sterilizer because it was too close to a sink. Well, there was a wall, a partition between the sink and the flash sterilizer. So
Wow.
there was no danger of, and the facility called me and said, you know how much it's going to cost to move that flash sterilizer? So thank goodness I always require anybody that goes in to take pictures, as you know. And she sent me the pictures, and I told them, I said, no, you don't have to move it. There's nothing wrong with this location, especially since we use closed containers now. But, you know, this is why you've got to have people that know what they're doing.
So what do you think here? You know, if a dentist wants to buy new instrumentation, buy a new sterilizer, or opening up a new business, what is their best route to make sure they're doing it right from the start?
They should consult with a sterile processing consultant who
Mhm.
can say, look, if you want to buy instruments, they have to be, you know, you could buy whatever brand you want, because they, you know, they usually buy the brand they trained on. That's the way it is.
Yeah.
Uh, so if you like Miltex instruments or Jared instruments, that's fine. I always tell them, get the IFU before you buy them.
Yes.
This way I can review it. Don't buy them, and then we have a nightmare having to send them back and restocking fees and what have you. Anything you buy, and I tell that to my surgery centers now, if you're going to change chemicals, monitoring supplies, packaging, or anything else related to sterilization, please get the IFU and send it to me before you purchase it.
Yep.
That's the
Um,
only way to stay out of trouble.
because a lot of times they don't do that. They get it. Somebody's in a rush to get it into the tray. They open it up. They wash it, and they sterilize it, and then they read the directions and realize they just bought it and they can't use it.
Yeah. I had one of my own facilities that didn't listen to me, and they went out and bought a new, I don't remember what the device was, but it was something for cleaning the scopes. Um, and when they called me up, they wanted me to do a procedure for them. So I told them to send me the user manual, which they did.
Uh-huh.
They had to use a specific detergent. You could only use this one detergent, which happened to be from the same company that provided the equipment. So I
Uh-huh.
called her up. I said, are you aware that you have to use a special detergent? So what's the matter with the detergent we have? I said, because you bought a new piece of equipment that requires a specific detergent.
Yep.
So well, nobody told me that. Buyer beware. Read your IFU. Now, the sales representative should have made that clear. And I don't know. I wasn't involved in the conversation, so I don't know if it was glossed over. I don't know. But the bottom line was she had to bring in a specific detergent that was outside of their contract with the other detergents they were using. And she's stuck with it now. So
Yep.
that's why I told them, get the IFU first so we can review it and see if you have to make any major change in either your process or the products that you use with it. Because if it's going to be 15 more steps than what I have now, I don't care how automated it is. People
Yeah.
are going to forget some of the steps.
And like we're kind of alluding here is there's sterilization IFUs, there's cleaning IFUs. You need to make sure you can clean it and you have what you need to clean it. The same. I mean, you might have 5 bottles of detergent and then come to find out you don't have the right detergent to wash your instruments with.
I went to a surgery center that was, they did a lot of peel packs,
Uh-huh.
and they had no IFU, so I was getting them for them. The peel packs they were using were only validated for gravity displacement, and they never get gravity there. And I found 4 more places since then that were using the same peel packs, and they never knew. Why? Because materials management, and I don't blame them, they're not knowledgeable in what we need. They're buying what we told them to buy. So
Absolutely.
they went out and they bought them. And I told them, I said, how many do you have? We have about 8 boxes. I said, well, good luck. You can't use them.
Yes. So and then again too, like we talked about earlier, we have Amy, we have CDC, we have OSHA, ADA. All that needs to be taken in consideration.
Yes. Well, CDC and OSHA, OSHA is regulatory. CDC are guidelines. AMI is a national standard. So those are the three.
Uh-huh.
Um, Now, if you have something in uh, the American Dental Association that is more rigid than AMI, then you would include that.
Uh-huh.
I think this new document, and I hope so, is going to have a whole section on handpieces because dental handpieces are a major, major issue. There is no way, in my opinion, to adequately clean them manually. At one of my own hospitals, when I was rotating through, because we had 9 hospitals at the time, and the very first thing I was hit with was the dental clinic called me and said, I want you to know that we're sending out all our handpieces for the 3rd time this month. Your staff ruins them every single time. And I said, okay. So first thing I do, I go up and make a visit there. I found so many deficiencies. My legs were shaking as I walked downstairs, and I said, "This is not going to happen." I got infection control. I told them what I found. We immediately decided we were taking all of the cleaning into sterile processing, and we would do the cleaning and the sterilization. They would be taken out for a number of reasons. But the cleaning, even though it was being done according to the IFU, still resulted in problems with the handpieces. So, and this is really funny. A couple months before, I was asked to give a lecture in Bangkok, Thailand. And while I was there, they gave me a tour of this hospital. I think it was like 2,500 beds. It was humongous. And when I went into the dental clinic that they had there, I saw this piece of equipment. And I said, what is that? It was a handpiece cleaner and lubricator. And I said, I've never seen that. So I remembered that. I went online, I found one, and we ordered it. And do you know, you put your handpiece in there, it cleans it and it lubricates it. And as soon as we put that into use, we no longer had any cleaning or failures with the handpieces. Mm-hmm. And I had to travel to Thailand to figure that one out. But, they don't even know that these things exist to help them with their processing.
So speaking of helping, like as you said earlier on this program, you wrote and developed the basics of sterilization for dental facilities.
Yes.
Does that now tell us about that book? Because I mean, you're the author, so nobody knows it better than you.
Well, the book, there's a textbook and a workbook, and it covers all the critical areas. It talks about rules and regulations. They need to know what they are. It talks about decontamination, all the different types of equipment and what the proper steps are. And we even have pictures of the different types of equipment, including a handpiece cleaner. We have packaging. We talk about making sure you have IFUs and that the IFU is specific to the sterilization method you have. Now, in the past, a lot of dental facilities were using chemicals with chemicals to sterilize their instruments, or they were using dry heat. But that pretty much is gone by the wayside because steam is so readily available and more economical and less toxic. But we go through all of them anyway. All the different packaging materials and how they're used. We demonstrate the correct packaging methods because that's a whole nother issue. And I think we have a couple. Don't we have a couple pictures of the packaging? I think there were 3 pictures together. The one on the left that has the 2 pieces of tape is done perfectly. The one in the middle, I have seen in many dental facilities. I don't know who came up with that, but that is not the correct way to wrap a package. And then the one on the right, that facility actually had syringes with the plunger in it, plus all the instruments were in a metal tumbler, which was then placed on its side and wrapped for sterilization. There was no way that you were going to get sterilization in that method. But again, they didn't know. That's the way they were taught. Nope. So You have pictures to demonstrate the correct packaging methods. And then we have a chapter on sterilization that talks about all the different methods of sterilization, the testing you have to do, the quality assurance testing. And then we have sterile storage, how to make sure that the instruments that you sterilized are being maintained sterile. So it covers everything they need to know. If they want to do it on their own, they could use the textbook and the workbook. But for people who need something more structured, we have the course online. And when you finish the course and you pass the final exam, you get a certificate stating that you completed the course. So we're trying to reach out to the dental community as much as we can.
Yes, your online dental course, dental sterilization course, which is a fantastic course. I've actually taken it. And recommendations, hygienists, it's even, I think, a benefit for the physician or the dental doctors to even look at that.
There should be at least one person in each facility that has taken the course. But if you have more than one person who is performing the processing, then both of them should, because if one's off, then they still have to know what to do. You cannot stand over somebody all day long and monitor what they're doing. People have to be able to get their work done. And so they need to be able to work independently, just like we have in a hospital setting.
And the course too, for infection control designees.
Oh, yeah.
Great opportunity for them to learn.
Yeah, because very often, even here, you and I will get a call from an infection preventionist to say, look, I don't know that much about sterilization, but I think this place is in trouble. You better get in there. And that's how we go into, and I do vice versa. If I see something, I'll inform infection control.
Yep.
That could be very helpful to them.
The book, would you consider that like, so if it, obviously the book is great for a dentist that wants to, make sure that they're doing everything correctly. Do you think a book would also be very beneficial for a dentist that was about to go into practice on their own and wanted to set up?
It might be, but again, I don't know. When somebody's setting up a practice, time is of the essence. They might use it as a reference book, but I don't think they would be able to really, you can't learn all this stuff just from reading the one book. Once you have the basic knowledge, then you have to, go through and get IFUs and see if they're right or wrong. And I don't see a dentist doing that. I see if in a dental facility, they should have a copy as a reference source for them. So if something comes up and they go, gee, I know I read about it, but I don't remember what we're supposed to do. Boom, there's your answer.
Yeah, that's, and there's no shame in that. I used to actually work with a surgeon years ago that if there are sometimes, certain cases that come around every 10 years. And I remember him, sitting in the break room reading about the surgery because it just, not something that he has done in a while, but had to do. And that a lot of people would go, wow, but I actually gave him a lot of credit for that because it's better than going in and winging it.
Yeah, I think one of the most important things for dentists when they're setting up their practice is to have their policies and procedures for sterilization. Otherwise, you're just going to have chaos.
Yep.
You've got to have strict guidelines, just like we have to have in any other practice, and that will set them in the right direction.
Yep. And the best, I would say, and I know you would say, if you're stumbling on sterilization, making policies as a dentist, the worst thing you could do, I would honestly say, is don't AI it. Contact a sterile processing consultant to help you with it. There's that human factor that has to really look it over and to make sure, because I know that's the new wave now, is becoming just have AI do it. And as somebody who uses AI a lot, there's a lot of mistakes.
Yeah, I'm not convinced about its total application in healthcare. I think in diagnostics and things like that, there's definitely going to be potential, but the policies and procedures to direct their practice is really important, and it's got to be done by a sterile processing person.
A person, definitely. and then let's see. Oh, we had this picture here, and I think
There it is. Every aspect of sterilization, from point of use treatment to
yep,
sterile storage, should be monitored for compliance with stated policy. That's the other thing we didn't talk about. How are the instruments transported from the operatory where they're using them to where they're being cleaned?
yeah,
They're just wrapping the piece of paper that with the instruments are wrapped in and walking through the hall. They're not confined, they're not contained, they're in violation of OSHA.
yes,
So you have to have a policy from the operatory to sterile storage, so everybody knows what to do.
yep. And I think we had one couple more. We had this picture, which we,
Yeah, this was just the correct loading of cassettes. You could either load them horizontally or vertically. And again, you have to have that airspace in between each one so that you can get the air out and the steam in. Otherwise, they're going to come out wet if you also stack them. There has to be that
yep,
airspace in between. I did have, this is another thing that most people aren't aware of. All sterilizers, including tabletops, have a maximum weight per tray and per load. So they'll tell you with this sterilizer, your tray cannot weigh more than 1.6 pounds. And you can 1.6 trays per load, and the total load can only be 7.9 pounds. Do they even know what their trays weigh?
uh-huh. Well, I tell you,
Many of them will tell you what the water quality should be. And I think there was a slide that showed one company's requirement for water quality. I don't know if I put that in or not, but if they say that you have to have reverse osmosis or sterile water or distilled water, but you still have to make sure that distilled water meets the quality standards for distilled water from AMI 108.
yep. All right. Well, I think we're going to call this one here because we're at a hour, a little over an hour, and I could imagine a dentist right now watching this going, "Oof, I got a lot to catch up on," which is very, very easy to do with obviously Sterile Processing University. We present this show, and we also have the education. So we have online training courses, textbooks, education books, all for dental sterilization, written by Nancy Chobin.
And we also do the audits. We'll go in and do an audit and tell you, look, these are the problems, and we can help you fix them.
Yep.
That's the first step, finding out where you stand.
And policies, procedures. I think you write the best policies and procedures I've ever seen in my life.
Right. Thank you.
Matter of fact, I will say this. Your policies and procedures are so good that they actually get stolen. People
I know.
them. That's so bad, but that's how good they are.
I've seen that, even though there's a copyright statement on them. I've seen them in other facilities, and I look at them and I said, this was copyrighted. And they said, no, I didn't. I said, well, it's right there.
But all right, Nancy, thank you again, everyone. Please like, subscribe to this podcast. This is only the beginning for dental. We have many more episodes to come, and check out Sterile Processing University's website. I'm going to have, at the end of everything, I'm going to have all our information. Please contact us. Let us know if you need help.
Yes, thank you. We'd be more than glad to help you.
All right. Thank you. For more information on our dental sterilization course or the book, The Basics of Sterilization for Dental Facilities, and workbook, please contact us at spdceus.com, or you can scan the QR code. To receive your free CEU approved by the HSPA, go to www.spdceus.com. Watch the entire podcast on the Sterile Processing University page, and then after that, you will receive a free 1-hour CEU. Thank you.
There's a girl you'll fall in love not a boy I know who wouldn't want to date her. She is the